Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? A recent report from the Center for Healthcare Quality and Payment Reform shows that over 130 rural hospitals have stopped delivering babies since the end of 2020. These closures represent a 13% reduction in rural maternal and infant care, leaving less than half of U.S. rural hospitals still even offering labor and delivery as a service. Travel time to care has increased as a result of these losses, and postpartum care is less likely to be made available. Without labor and delivery care, rural communities are left vulnerable to emergencies and high-risk situations, which can be especially dangerous when transportation is limited and ambulance services are strained. The center found that the most significant causes behind rural maternity care closures are national workforce shortages, inadequate reimbursement models from private payers, and the downstream effect of inadequate reimbursement for other hospital services the hospital provides. On to the damage report. Researchers are tracking correlations between health funding cuts and rising disease threats. In New York and Florida, flesh-eating bacteria has been found in coastal waters, and infection cases are experiencing an increase from 2025. Just last month, the USDA confirmed the presence of New World screwworm in the U.S., threatening the well-being of livestock and farms. Though the USDA's inspection service responded immediately upon detection, it is working with 18% less workforce than this time last year due to the federal funding cuts. Some life-threatening diseases come from bacteria found in seafood, such as raw shellfish. While previously these threats were under surveillance by deep-sea monitoring systems, the instruments collecting the data have been removed and research cut short. The researchers behind this study expressed concern that this year's increased risk of threats to public health is compounded by the Trump administration funding cuts for the programs and agencies our communities rely on to track and prevent these kind of health hazards. It's alarming how quickly our communities have faced new threats without the adequate resources needed to respond to them. Additional programs experiencing drastic cuts include vaccine research, global food and agricultural safety programs, and the dissolving of the U.S. Agency for International Development and the CDC's Division of Parasitic Disease and Malaria. Shutting down USAID and withdrawing from the WHO have not only put countries requiring humanitarian aid at risk, but also put the U.S. at greater risk of exposure to events like current Ebola outbreak in the Democratic Republic of Congo. Rural community members often experience longer wait times for emergency care when they call 911, leading to poorer outcomes in situations when timely care is vital. Workforce shortages and ambulance expenses are the leading cause of this disparity in emergency care. To aid in their rural communities, Minnesota developed the Sprint Medic program, which employs traveling paramedics and pickup trucks that are equipped with the same life-saving equipment that can be found in ambulances. Paramedics in the program can respond immediately to healthcare emergencies, often stabilizing patients well before the ambulance arrives. Programs like this both showcase the ingenuity so often found in rural healthcare and emphasize the need for better resources for our rural hospitals and our neighborhoods. Thank you to our sources for this episode: the Center for Healthcare Quality and Payment Reform, KFF Health News, EOS, the U.S. Department of Agriculture, CDC, Board of Southampton, Health News Florida, USAID, and to NPR News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.